I'm Alan Brown. I'm a board-certified pediatrician. It's really fun for me to watch these kids go from these tiny little helpless babies to little humans that have personalities and can talk and explain what's going on in their inner world. My philosophy towards practice of medicine is really to provide patients with the care that I would want to receive if I were the patient or if it were my kids receiving my care. And so for me, what that means is to be giving them kind, courteous, at the bedside care, but also the best level of care available as far as following the latest guidelines, being the most up-to-date as possible, giving the appropriate and recommended treatments is really what I would want for myself or for my own children. And so that's the kind of care that I strive to provide. So I think reassuring parents is a huge part of what my job is. I really enjoy teaching, so I like explaining to parents what's going on, and then I just like kids. I have 4 of my own, and I like them and like being around them and their friends and being with other kids. So the things that I do to try and help patients feel more comfortable in clinic really vary depending on the age of the patient. And so for younger kids, a lot of times it's a matter of just kind of giving them some space as you come into the room and letting them hide behind mom's legs or hide under the chairs or whatever it is they need to get comfortable as I sit and visit with the parents and kind of get some information. Looking in ears is always a kind of traumatic thing for a lot of little kids, and so usually the best way to do that is snuggled close in the parents' arms with mom giving a big hug and holding their head still, and that way it's the least traumatic and they're happier and I'm happier. And so as much as possible, I like to let them be with their parents for the entire exam. For older teenagers, it's really just kind of trying to engage them on what's interesting to them, what's important to them, communicating directly with them rather than just talking around them to their parents. So it really just is a very individualized thing depending on the age of the child and the particular child as far as how I approach each situation. Evidence-based medicine is really the backbone of the way I practice medicine. And so for me, that is my job, is to look and see what those recommendations are and to provide those recommendations to the families that I take care of so that their kids can be getting the best care that we know how to give. So I am a native of Wyoming. I was born and raised in Star Valley, Wyoming. Grew up there. My parents still live there. Did my medical training and have been back in Wyoming since 2016. Really happy to be back.